Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care, affiliated with Henry Ford Health System, St. Joe, Oakland, and Bowman. The theme of our health talk today is a difference between perimenopause and menopausal syndrome. Joining us today is our gynecologist, Dr. Mona, and she's a practicing gynecologist, and she will highlight our viewers about the difference between the perimenopause and the menopause. How do you make the diagnosis and the treatment? So good morning, Mona, and welcome to my show.
Good morning, and thank you for inviting me on your show.
Yeah, and I was looking forward to hearing from you because last time you were out of country. So can you please first give your introduction to our viewers?
Sure. As you said, my name is Mona Hardas. I'm a practicing gynecologist. I've been in gynecology for over 25 years. I am a board certified by American College of OBGYN. I also have special interest and training in cosmetic gynecology, and I am a fellow of the International Society of Cosmetic Gynecology.
That is great. Yeah, it's so good to thank you for coming to my show, so you can share your expertise, with us. So first of all, what is exactly perimenopause, and how do you differentiate it from the menopause?
So perimenopause is a phase of life which can start in your late 30s, but most likely in your 40s, and can last for about 5 to 10 years, and it ends in menopause. So menopause means when you do not have a menstrual cycle for over 1 year. So no cycles for 1 year, we call that menopause, and a phase before that is a perimenopause. So what happens in perimenopause is that there's a lot of fluctuation in the hormones, especially the estrogen and the progesterone.
Yeah.
So symptoms you'll hear like hot flashes and night sweats and weight gain, brain fog, vaginal dryness, fatigue. All those are more in perimenopause as compared to menopause. So when I explain to my patient, I say perimenopause is like a roller coaster because it's an unpredictable hormonal shift.
Right, yeah.
And menopause is like a destination. You reach it, you're there.
Yeah. So
Yeah.
before, wasn't it menopause age was like 50 and over?
Yes, the menopause is between 51 and 53. That's the average age.
Yeah, average. And
Yes.
then perimenopause symptoms, which could be easily ignored, right?
Correct, yes.
Yeah, I know. I have a lot of patients, when they will come to my clinic, hot flashes and this and that, in 40s. So what do you tell them? I said, you have to see a gynecologist because those could be the early symptoms.
Those are, and as I
Yeah.
said, they can start about 5 to 10 years earlier
to
than
10
that,
years.
and because of the fluctuation in the hormonal level.
Yeah,
And a lot of time women think they are because of the stress and they just ignore it,
That is true. So what is exactly perimenopause, and how is it different from menopause?
So perimenopause, as I said, is a phase. It's not
It is a
it's a
phase.
stage, right? It can extend for about up to 10 years, and it's because of the changes in the hormones. There is a slight decrease in the estrogen level. The fluctuation is very unpredictable. Your menstrual cycles can stay regular for a few months, and all of a sudden they start becoming irregular. Before your menstrual cycle start, you might start feeling, oh, I'm getting hot, I am getting night sweats, I'm waking up in the middle of the night. That's because of the decrease in the estrogen level. Your libido might decrease, you might start feeling the vagina is dry and is uncomfortable during sex. Those are all because of the changes in the hormonal level.
Yeah.
So that's the phase we call perimenopause.
So that is the time you want to start the treatment, right?
Absolutely, yes.
As a gynecologist in this particular field,
Yes.
you like to catch them in that stage, right?
Exactly. Yes.
Yeah,
Yes.
so
yeah.
that's why you want to catch them. So why are high perform? Yeah, this is good. Why are the high performing women get more of these symptoms? Is it because of stress?
So, when you are in a high performing job and higher achieving person, they
Right.
always are working under stress, right?
Right,
They have
right.
deadlines to meet, they have goals to meet.
Deadlines,
So,
right.
they are working hard, they are not getting enough sleep.
Right.
They are not really doing a whole lot of a stress, they are stress management or a whole lot of a self-care. They are so used to work under this high cortisol level, right? It's a
Right.
stress hormone which
Right,
is
high
high in them.
cortisol.
So as perimenopause happens, the estrogen level goes down. So the cortisol, which is high, is now buffered by estrogen.
Right.
And all of a sudden, they were doing great all this time because estrogen was balancing their cortisol. But because there's a decrease in estrogen, they start feeling tired, fatigued, not remembering things, and they start feeling like, oh my God, I'm falling apart. You're not falling apart. It's
No,
just
it
the
is
hormones
just that,
which are
it's
changing.
just that there's a high level of cortisol. Yeah.
Yes, correct.
And that's what is acting, and that's what is causing the symptom. That's why, yeah.
Yeah.
Similar things for the men also, right?
I'm pretty sure, yes, yeah.
The men also, they can get it, yeah. So now, I know, weight gain is such a big issue going on. Yeah, there has been so many medications, new medicine for
That's
the
true.
weight gain. Could you highlight about our viewers about the weight gain with the perimenopause?
So in perimenopause and menopause, weight gain is not inevitable, but it's very common. Very common. You
Yeah.
hear this a lot from my patient. I hear it, oh my God, I started gaining weight. What's happening is that as the estrogen level goes down
Goes
with the
down,
perimenopause and menopause, the body's weight, the fat storage changes. You start storing fat more in your abdominal area.
Yeah.
So the central body obesity, you're gonna start seeing. Your metabolism decreases. Your metabolic rate
Metabolism
decreases.
Is lower.
It is decreased. Your muscle mass decreases, right? And your sensitivity to insulin decreases. So as the
Yeah.
insulin resistance increases, you're gonna see the weight gain. That's again because of the hormonal changes.
Hormonal. So weight gain is a precipitating factor of premenopausal or menopausal, and that is because of the hormone imbalance.
Imbalance, correct. So just eating less is not the answer.
Right, yeah.
It's not. You can keep cutting down what you're eating. It doesn't because there are hormonal changes. So what you really start doing is to get the
Exercise.
strength training. Really, really important because we have to build our muscles.
Yeah.
You're losing muscle mass there. You have to increase your protein intake. You have to get good sleep. So get your sleep hygiene and stress management. Nothing like stress management. So.
Yeah. So now, do you want to say a few words about intimacy?
Sure.
Is one of the questions you
It
have?
is a very common symptom.
Okay.
Again, because of the lack of estrogen,
Lack of estrogen.
the lining of the vagina thins out. So the
Right,
vagina is not producing as many secretions as it used to be.
Yeah.
So there's a dryness. There is a decrease in the elastic and collagen tissue. You see it rest of our body. We see it on our face, on the
Right,
body.
right.
Same thing happens in the vagina. So the elasticity of the vagina is decreased.
less, yeah.
There is a dryness in there that causes pain and discomfort. And that's why there is a decrease in the libido also.
Okay.
So decreased hormones will cause decreased libido, but also because of the physical changes and the
Changes,
discomfort during
yeah,
sex, it
yeah.
decreases
So
the libido.
Then you prescribe lubricants.
So
or
yeah,
you
there are
do
lots of really things you can do. You can start just with over-the-counter lubricants. There are a lot available out there. I would say, just use a lubricant with water-based or like a silicone-based.
Oh.
You can use vaginal estrogen or can go on a estrogen replacement
Yeah.
therapy. We have a lot of energy-based devices now, especially the radio frequency, which helps in building the elastic and collagen tissue as well as the dryness it addresses.
Yeah.
Testosterone also helps down there. Physical therapy, pelvic physical therapy can also be added. So there are different modalities
Different
we can
modalities,
mix and match depending upon your need.
So basically, the treatment of this particular condition is use the vaginal lubricants or different kind of medication and physical
Therapy and some
right?
energy-based
Yeah,
devices, yeah.
Yeah. So this is a hormone replacement therapy. What is the safety encountered? Is it safe? to use?
Everybody worries about that.
I
So
know,
what
yeah,
happened
it's
is like in 2000s, there was
Yeah.
a women's health initiative study. And
Okay.
everybody who was on hormones was taken off the hormones, and people start worrying about the risk
About-
associated
I
with
think
hormone
I read
replacement.
that particular
Yeah, in 2000s,
article,
it
yes.
yeah.
Hormone therapy was off for
Yes.
some time.
So now, over time, we have learned that what really matters when you start the hormone replacement is the age when you start it, the type of the hormone you're giving a patient, how many years has it been since she went to menopause, what kind of hormones you are giving, and the route of the hormone. So, for example, a healthy woman who is less than 60 years age, who is less than 10 years from menopause, hormone replacement therapy is very safe.
Very
and she should
safe.
take it because it will help with her symptoms as well as continue with her bone mass, with her muscle mass, metabolism, all that. Say if a woman is over 60 years old age and is over 10 years from menopause, she
Right.
still can use vaginal estrogen for vaginal health. And if she has symptoms, she can consider some non-hormonal treatments which are out there.
Yeah. What would you suggest for the senior citizens, like people like in 70s, 80s?
80s, yeah.
Is it still safe for them?
For them, vaginal estrogen is very safe.
Is safe.
It's very safe.
There's
You-
no systemic absorption.
No, it's a very small amount of estrogen. It is just locally absorbed,
Okay.
and the dose is very small, so you don't have to worry about cancer risk or blood clots or anything like that for
Right.
them. Yeah.
Yeah.
They can also use those radio frequency devices which are out there. We actually nowadays use a PRP or a platelet-rich plasma to build the elastic collagen tissue if necessary.
Oh, okay.
So
yeah.
there are a
bec-
lot
I
of-
think I read it someplace. Build the extra collagen.
Yes, exactly.
Yeah,
you can
you
use that.
It comes in a solution. Or
No, it's you basically draw blood. We
You
will
draw
draw
the
the
blood,
patient's
okay.
blood,
Huh.
and we centrifuge the blood, and we separate the plasma from the red cells. The
Okay.
plasma is the one which you use, which is a platelet-rich plasma. It
Oh.
has a growth factors in
Okay.
it. So.
So draw the blood, get the plasma rich. That
Yes.
is- I mean, there has been so many treatments more now.
There are,
Before
there are.
we didn't have all this treatment.
No, we didn't because
Yeah.
there was no money in the women's health, right?
No
so there
money.
was no funding, so there were no studies done.
Yeah. Now
So-
women's health has become so much. It has got so much of importance.
And it should
Women's
be,
health
right? It should
should
be.
be.
50% population is women.
is women.
And we
right.
were always told in the past that, oh, menopause is just
Longevity
aging.
is
Yeah.
getting-
Just, it's just a part of life, live with
Right.
it. No, you don't have
Right.
to.
No, there's so much things to be done.
Yeah,
right there.
absolutely.
Mm. What is one symptom that women should not ignore?
Very important question, I would say. If there is a postmenopausal bleeding, you're
Oh,
in menopause
okay.
and you start bleeding,
Right,
do
correct.
not ignore it.
Right.
Do not say, oh, it will go away. That's very important.
yeah.
All of a sudden, if you have severe depression, I would not ignore that.
Okay.
If you have a significant memory loss all of a sudden, don't blame menopause for this.
Okay.
Don't ignore it. And if
Yeah.
there is a sudden unexplained weight change, I wouldn't
Weight,
ignore
that
it too.
too,
Yes,
whether
yeah.
excess weight.
Excess or a loss of weight, either
Right.
or. Don't say it's a menopausal
So most
stress.
important thing is bleeding.
Bleeding.
If there's a bleeding, there's always some
Absolutely.
malignancy
Could be.
someplace,
Could
right?
be, yes, possible.
Yeah.
So really important to go and get checked
So
out.
one symptom, nobody should.
Yes,
Should
ignore it.
ignore,
And if
yeah.
there is a persistent pelvic pain, I wouldn't ignore that too, because menopause should not cause any pain. There's something going on.
Something going on, right? There can be so many, like 2 months ago, we have this breast cancer awareness month.
Yes.
And there's so many things, like occult breast cancer,
Yes.
how you determine it, all that.
Yeah.
Many times it goes unnoticed, but later on, it goes to, once it affects the
Right.
vagina
Yes. Yeah.
or the cervix, and so that is why that is very important.
Yes, I think so. I think anytime there's bleeding, get checked out, go to your gynecologist.
Right, yeah. Do
Yeah.
you see a lot of those patients in your
I,
practice?
I do though. I really do.
You do?
Yes, yeah.
Yeah.
Hmm.
Do you see patients with endometriosis also?
Yes, I
Yeah.
do. Yes, I do.
Because we had so many patients, with endometriosis.
Yes.
Yeah.
It's very debilitating condition.
Yeah, right.
Yeah.
Yeah.
So again, early treatment, early diagnosis and management very important.
It
in
is
those
much
patients.
important. Yeah. Is there any association between that and the fertility?
If endometriosis is involving the tubes, it can cause the tubal blockage. If
Okay.
it is involving the ovaries, then it will, the ovulation may be affected. If endometriosis is on the back of the uterus, we call uterosacral ligaments, right? If
Yeah.
it's involving that, it causes very painful sex, and then
Yeah.
that can affect it. So it depends upon where the endometriosis
Yeah, I
is.
remember back when I was in active practice with all this,
Mm-hmm.
all those endometriosis, dysmenorrhea used to come
Right.
to the office with so much of pain, and now treatments are available
There are.
with the advances in the medical science.
There are. So again, but they don't get diagnosed early, so it's important to get
can-
diagnosed early so it can be
It
treated early.
can, yeah. And so far as fertility is concerned,
Mm-hmm.
also depends upon the other partner also, right?
Correct.
Right?
Yes. Yeah.
Yeah, both of the partner has to
Absolutely. Get checked out. Yes.
endometriosis. So what is anything else you want to talk about?
Well, I just want to kind of end up with a message for a woman.
Yeah,
Like, don't
yeah.
suffer in silence. I would
Yeah,
want to tell them
empowered.
you're not crazy, you're not lazy, you are not falling apart. This is just a phase of life because of changes in the hormones.
Yeah.
So, with proper support and a treatment, you can come out of it more confident, more self-assured and happy. So there are treatments. So please see your
Yeah,
gynecologist.
Don't ignore your symptoms.
Correct.
Don't be afraid.
I know,
And
right?
also, the hormone therapy has become the way of regime for right
It
hormone
has.
therapy.
FDA just came out. They took the black box warning away from the estrogen now. That's used to scare patients whenever we prescribed estrogen to them.
Yeah.
They would read that black box warning and worry about all the side effects. But since it has been removed, I think women are feeling
Yeah.
more comfortable and more confident about using hormones. So I'm hoping that we're going to see more and more people use
But
it.
estrogen and progesterone both, right?
Yes. So if you have a uterus, you're going to need a progesterone because progesterone is like an anti-cancer on the uterus. But if you had a hysterectomy and a uterus removed, then only estrogen.
Only estrogen.
Only estrogen for those. And depending on your symptoms and the levels, you may or may not need testosterone.
Okay.
So in some women
So,
they
Mona,
do.
how often you follow this patient once they are in estrogen? For
So
this?
it really depends depends on their symptoms. I see them, I start them on treatment. I would follow them in 2 months to see how they are doing.
First in 2 months.
In 2 months, and then after that, again, there's a nothing. It's not like one dose fits all, right? It's not
No.
one treatment for all. So
No,
you have
you
to
have
keep
to.
adjusting, and a lot of time only hormones is not enough because they will help with some but not with everything else. So we do add, as I said, the radio frequency devices, PRP, pelvic floor therapy. So depending upon what other modalities I have used, I would see them every 3 or 6 months or so.
Every 3 to 6.
And once they are all well, then once a year.
Right, yeah.
Yeah,
So
yeah.
once a year, so for our viewers to know, with the gynecologist, one every year, but if there's symptoms, no improvement, and then see very often.
Yes.
And the red flags is the vaginal bleeding.
Bleeding, yes,
Or
correct.
sudden weight gain.
Correct, yeah. Or depression, all of a sudden severe depression.
Yeah, the
Or,
depression is related
Or
to-
memory loss, because it's some brain
Yeah.
fog is associated, but a lot of memory loss is not menopause. There's something else going on,
Yeah.
so they need to be
Is there
checked out.
any link? Is there any genetic link between the whole thing, memory loss and menopause?
Not a genetic
it's
link.
not
No,
genetic.
no.
Okay.
Not so far I know.
So
of.
far, no. But somebody will come
Yeah,
up.
who knows, right? The research is progressing
Somebody
so
will
much.
come up in future,
Yeah.
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 So basically, these are the things we have to watch for. Yeah, so message you gave. So 1 minute, last keynote advice.
I would say,
Besides,
I-
don't ignore the
of course, don't ignore the symptom. That's
Right,
very
yeah.
important. It's our mindset, right? Menopause was always framed as aging. It was never framed as transitional. So what I want to tell women that it's a transitional phase going through perimenopause and menopause. You're not alone. You should not be suffering alone.
Right.
There are so many different treatments and modalities available. All you have to do is talk about it. Talk about it, discuss it with your gynecologist, find an expert, go to them, get help. Because why suffer?
Right.
There's no reason for
Social
it.
service platform, very important, isn't it?
Yes.
Mix up. You are mixing with the same group of people. They have the similar symptoms.
Symptoms, yes. So discuss with your
you
friends.
can talk about that and all those. So that's very good. Don't be afraid of cancer because you don't know.
No, if you have been properly monitored, you shouldn't worry
It
about
shouldn't
that.
be. Even though with the birth control pills, so many kind of cancer.
Yeah, but see, birth control
Right.
is totally different than hormone replacement.
Hormone replacement.
The hormones in it are different, the dosage is different, and that is appropriate for that age group. For
Right.
perimenopause and menopause, the type of estrogen and progesterone we use is different.
Estrogen.
The dose is much smaller
Much
than that.
smaller. So basically, that's what it is. Very small dose. So you
Right.
don't need to worry about
Correct, yes.
that. So, all right, then I like to thank you for coming to my show. I like to thank our viewers for watching my show and with the menopause and the perimenopause difference between the two. I like to thank you for coming to my show. Thank you, producers and the camera people. And until I see you guys, have a safe and a wonderful spring.